My name is Lindsay Smith. I am one of the managers in the Access to Funding department at the Global Fund, and I am delighted to be introducing the topic of our webinar today, which is one of a series of webinars that we are hosting to help our external stakeholders prepare for the next funding cycle, and specifically prepare for the development of their funding requests, which is one of the first stages of the funding cycle. The topic of today's webinar is on country dialogue, around the expectations for country dialogue, and I have several other panelists that are joining me today, so you won't just be hearing from me. And in fact, the first panelist that I'm going to invite to turn on his camera and take us away is my colleague David Ennis from the CCM Hub. David, if you'd like to introduce yourself, and I'll just move the slides forward.
Yeah, thank you very much, Lindsay. Real pleasure to be here today, and welcome to everybody who's joining from across literally the whole world, I think. So as Lindsay said, my name is David Ennis. I'm the manager of the CCM Hub in the Global Fund. I'm talking today a little bit about country dialogue. So what is country dialogue? Well, at a high level, the country level dialogue process is how all stakeholders involved in the response or impacted by the three diseases come together, review progress and challenges, and agree the best ways to combat the three diseases going forwards. The process is led by the CCM rather than by the Global Fund, and is intended to be an open, multi-stakeholder, country-owned and country-led process. It can extend beyond the CCM members and their constituents to include non-CCM members and wider groups, basically everybody important to impact the three diseases. For us, we believe it's good practice for CCMs to explicitly develop and share in advance an engagement plan for the dialogue, so that all stakeholders can see how it will be run and therefore how they can feed in. Some CCMs support a community dialogue element and a technical disease focused dialogue in parallel, and then work to bring both of these strands together to inform the final funding requests. But there are lots of different approaches. The important thing is that the dialogue allows everybody's perspectives to be fed in, especially those most impacted by the diseases, giving stakeholders a voice in the development and agreement of priorities. So in line with this, CCMs should really think about their membership and who they represent, and whether they represent all the right groups well in advance of country dialogues, and whether any changes or elections may be needed as a result of that. And the CCM Hub can provide support for this as well, if helpful. And in many countries is already doing so actually through CCM Evolution and other projects. So this kind of engagement is a core founding principle for the Global Fund. But it's also about questioning our assumptions about what's working or what's appropriate for each group, and ensuring we continuously increase the effectiveness, the equitability and the targeting of disease programs. The Global Fund's new strategy introduces a number of key strategic shifts, which we believe will also increase the impact of programs. And it's important that what these may mean in practice in each context are discussed during the country dialogue in order to show at funding request stage how these may be used to drive impact. Next slide, please. Who exactly needs to participate in the country dialogue will really depend on each country, which actors are present, and the particular epidemiology of the diseases there. But some groups, such as country governments, key populations and communities living with the three diseases, need to be present in the majority of cases. But other groups might be more context specific. For example, including refugees or people who represent refugees, where there are large numbers of these in a country. Or private sector actors, if a lot of primary healthcare services are being provided privately. So this is just an illustrative list to help CCMs and others reflect on who they should include. The right participants always really depends on country context. But it's important to think beyond the usual suspects and to ask if new groups are important, and if so, how best to involve them. Making sure experts involved in the country dialogue process link between the different strands of the process can also be important sometimes. So, for example, perhaps ensuring that malaria experts also participate in wider discussions on broader RSSH, or Resilient and Sustainable Systems for Health priorities. Principal recipients are also a potential actor here in the country dialogue, but they're not always involved. But for this cycle, we think if the PR is continuing, which a lot of them will be, we think including them in the country dialogue is a good idea. This can improve how quickly the grant is ready to implement, but it can also mean that more details of the grant can be discussed earlier during the funding request development stage, which in turn we believe will give more opportunities for CCMs and communities to be engaged in program design and selection. Next slide, please. So the feedback we've had from surveys of CCMs and non-CCM members after each funding round is actually quite positive. So we should remember that actually we're building on success largely in the way that CCMs and others have engaged in country dialogues over at least the last 2 funding rounds. And we think the majority of CCMs actually manage country dialogue processes pretty well. So for the last funding round, 93% of applicants rated their experience of the country dialogue positively, compared to about 88% in the previous cycle. Representatives from key population groups felt freer to express their views and felt more prepared to participate and add value to the funding request development. 85% of key population respondents also felt that those coordinating the country dialogue had actually actively reached out to groups of CSOs and KPs as part of the process. And we had feedback as well that suggested that the virtual dialogues that were held as a result of COVID-19 for the C19RM applications over the last 2 years actually also were greatly valued by some of these groups and led to greater participation from these in country dialogue. So there's something there to think about in terms of what we might use going forwards. So although inclusion of communities and key populations remains very challenging in many settings, and there are issues as well about the conversion of priorities raised and expressed during dialogue, country dialogues, into actual grant design, we think there are some very strong positive examples to build on. I'll go through a couple in a second. Next slide, please. So a few of these are listed here. Really people taking the time, CCMs and countries taking the time to think about how they might strengthen engagement through country dialogue and being quite innovative in some cases. So in Kenya, the CCM purchased data bundles for its constituents to ensure their engagement during COVID-19 was inclusive and safe. In Indonesia, the CCM KP representatives and technical partners used bilingual social media platforms to engage constituents during country dialogue. One community-based HIV advocacy organisation used its account to share information on Global Fund and WHO workshops, progress on the development of the funding request, and to provide links to relevant support so everybody knew what was happening. The tweets were in English and Indonesian, allowing more stakeholders to participate. And the organisation also created a YouTube video on how to get involved with the country dialogue. And then finally, in Malawi, the CCM partnered with a community-based organisation experienced in LGBT advocacy to consult with men who have sex with men and sex workers. Instead of relying only on general adverts in newspapers or untargeted email invitations, the CCM ensured it could collect quality data from consultations through an established network and CSO partner. Through this partnership, communities and key populations were much more effectively engaged in the development of the HIV funding request as a result. Next slide. But we often focus on country dialogue a lot during the funding request stage. However, this really should only be seen as the start of an ongoing engagement and dialogue process between the CCM and stakeholders, which should run throughout the cycle. Meaningful engagement and dialogue should happen during grant making and grant implementation as well. So we're increasingly developing minimum expectations in this field, which my colleagues will talk a bit more about later. But during funding request development, we expect a transparent consultation, including all stakeholders and populations impacted by the diseases, and a fair and open process to select PRs. I mentioned the positive feedback we have on country dialogue engagement after the last cycle. However, there were concerns raised there too. about communities and civil society organisations seeing the final version of funding requests and about how civil society and community priorities were included or represented in these. So as a result, for the new cycle, as we did for the C19RM applications, we're asking for a new annex capturing the priorities of civil societies and communities, whether or not these actually made it into the final funding request. By comparison, only 60% of those responding to the survey I mentioned earlier thought civil society and community representatives were well involved in grant making. So for this cycle, we're working to ensure more timely access to information on the status of grant negotiations and of any changes that get made to the grant during this part of the cycle. And my colleagues will talk about this in a bit more detail later. And then finally, for grant implementation, we want all stakeholders, including community and civil society representatives on the CCM, to have better access to information on programme implementation and on performance, revisions to grants, and reprogramming. Transparency about changes and the reasons behind decisions is a very important aspect of meaningful engagement, and we'll be communicating more on this over the next year. Thank you. I'll hand you back to Lindsay.
Thanks so much, David. So I will, just to summarize what David has established for us, David has identified what we mean by country dialogue, why we do it, why it's important, who should be involved, and he's also established with this slide the new expectation that indeed we do anticipate and expect that country dialogue will continue throughout the grant life cycle, and we're going to be more intentional about that in the upcoming funding cycle. So now we're going to switch gears a little bit, and we're going to talk about that period of country dialogue leading up to the funding request development. We mentioned that already in terms of the experience, this has been overall quite positive, but we wanted to talk about in light of the upcoming funding cycle, how we need to think differently about what needs to happen during that country dialogue leading up to the funding request stage itself. So the starting point of that is actually that we have a new Global Fund strategy, which is for a 6-year period. And so this coming funding cycle is the first stage of this new strategy coming to life. And why that's important is because some of the new elements in the strategy are quite a significant step forward in terms of what our ambition is as a Global Fund partnership. And so it's important to be aware of the strategy and to start thinking about what shifts will be needed in the overall thinking about what goes into our funding requests and finally what goes into our grants as a result of the strategy itself. Now, this is a strategy that the Global Fund did not make up on its own. This is a strategy that through extensive consultation, over a year of consultation, thousands of people were involved across the Global Fund partnership to actually contribute to building this new strategy. So donors, implementers, technical partners, there were lots of voices across the partnership that were actually heard to be able to bring this to life. And one of the most important voices in this partnership, of course, is our group of civil society and community members who loudly spoke about the importance and the need to really bring people and communities into the center of what the Global Fund does. And so this is visually reflected in the new strategy, this nice circle right in the middle. Keeping people and communities at the center has been something that has been adopted by the Global Fund, both visually and also in terms of where people and communities are in terms of the expectations for the next funding cycle. You'll see that come through in our updated forms, in our new annexes, and the expectations for what's to come in this funding cycle. Now, our primary goal has not changed. The idea of ending AIDS, TB, and malaria is central to what the Global Fund is about. And indeed, that will be the focus as we move forward. But the strategy itself has 4 pillars in terms of contributory objectives, and then one evolving objective, which is very much linked to our overall approach to resilient and sustainable systems for health. So just to make sure that you're familiar with these pillars, the first one is about a people-centered and integrated system for health. So this is the idea of more integration in terms of health service delivery and are thinking about how we can ensure that the experience that our beneficiaries have as they seek access to services and treatment is as integrated as possible. So since people-centered integrated systems for health is the first pillar. And if you're familiar with the Global Fund's modular framework, we have integrated pandemic preparedness into the modules that relate to resilient and sustainable systems for health. So that's very much how this evolving objective is going to be operationalized in the upcoming cycle. The second pillar is about maximizing engagement and leadership of most affected communities. And this is very much about having the people and communities at the center of what we're doing. And so you will see in a later part of our presentation some new expectations that relate to how we want to set the bar higher in terms of the overall engagement, not only at the funding request country dialogue stage, but throughout the cycle. And then finally, maximizing health equity, gender equality, human rights. These are not new concepts. These are areas that the Global Fund has been committed to for many cycles, and they have now a prominent place in terms of being our third pillar in order to address the need that we have to ensure that we are actually going to be adapting our evolution in disease responses based on updated evidence to actually ensure that we can address the global goals that have been established with the Sustainable Development Goals of 2030. Now that's our target. We are not close to being on track for that yet. We've had some setbacks. And so we really need this upcoming funding cycle to really be the linchpin that takes us that big step forward in order for us to be able to achieve those very ambitious 2030 goals. And to get there, that fourth pillar of mobilizing increased resources will be essential, not only on the Global Fund side, but also on each individual country that is eligible for Global Fund financing. There is the expectation and the need to make sure that we are working with you to be able to increase the domestic resources available to be able to establish those programs that will allow us to achieve the primary goal of ending AIDS, TB, and malaria. So that's the big picture. And the end result of this would be that the Global Fund's intention is that with this ambitious strategy that has been jointly through a partnership established, that we would support our countries to achieve their country-owned program objectives for the national goals, as well as achieving the global goals, which are even more ambitious than what we've had in the past. There are 10 different areas of the strategy that are considered particularly new or different. I've got them on the screen here. I'm not going to go through them in detail, but this is something important for us to all reflect on in terms of how we think these could come to life. And as we have been discussing that within the Global Fund Secretariat, it's become very clear to many of my colleagues that it is country dialogue that is a big lever to actually thinking about bringing some of these ideas to life, because we need to make sure that some of these ideas around prevention, for example, or around the idea of sustainability overall, these conversations need to happen already at the country dialogue leading up to the funding request stage in order to be able to see them brought to life and fruition in the grants themselves. Now, with that background of we have a new strategy, it's very ambitious, it ladders up to the global goals, and so as a partnership, we collectively need to work together to bring it to life. Now the question is, okay, so what does that mean for the requirements for a funding request submission? There are 4 key areas of output that we're going to discuss in a bit more detail. One area is around the analysis of the gaps and the discussion around program split. Another area is then within the understanding of what the gaps are, aligning on where the Global Fund investment would be best designed to achieve highest impact. So that prioritization of the funding request can only happen when these 2 elements come together. And this is an iterative process in terms of understanding the data and the evidence, analyzing it, and then in turn discussing where the Global Fund investment would make the biggest impact. So those 2 areas are a key part of what needs to feed into the funding request itself. Another expected output of the dialogue at the funding request development stage is the confirmation that the CCM has effectively been able to demonstrate that it's met the criteria for eligibility requirement number 1, which is around inclusive and transparent dialogue, and eligibility requirement number 2 around the selection of the principal recipient. And then finally, the output of country dialogue at the funding request stage is the funding request itself, the forms and the annexes that go along with it. So I'm now going to turn over to my colleague Olga to speak to the expected output areas 1 and 2, and then I will come back to speak about areas 3 and 4.
Okay, so good afternoon, colleagues. My name is Olga Bornamisa, and I'm one of the Senior Health Systems Advisors at the Global Fund. So I'm going to talk you through the first 2 areas that Lindsay just mentioned. So program dialogue. First of all, I want to explain that the Global Fund continues to have a program split process because it wants to encourage countries to discuss if the allocations for HIV, TB, and malaria, as shown in the allocation letter, are still appropriate based on local context. So for example, there can be changes to the funding landscape at the country level. For instance, another donor may have come into a country and increased or decreased funding, and that may influence how the CCM would like to split the allocation between HIV, TB, and malaria. So, as before in the last cycle, the Secretariat will continue to recommend a program split for eligible components in the allocation letter, and countries are expected to discuss this during their country dialogue. Countries are then expected to submit a form that either confirms or changes their program split. Just a tip that if a CCM is considering significant changes to the program split, we suggest they raise this with the country team as early as possible to prevent any delays to approval of the program split. Now, what's new on the bottom left-hand side of that slide is that we expect CCMs to fill in an indicative amount for RSSH from each of the 3 disease amounts. And I'll explain a bit more how to do this on the following slide. Global Fund is requesting this because it has increased its commitment to RSSH based on the new strategy, as Lindsay has just explained. And the Secretariat recognizes that the lack of an RSSH allocation can be a big challenge for CCMs. So now if you turn your attention to the right-hand side of the slide, this lists a few inputs to the discussion that can be helpful for the program split. First of all, we strongly recommend that CCMs fill in, at least at a high level, a programmatic gap tables and the funding landscape tables for HIV, TB, and malaria. We also recommend that they fill in the new RSSH gaps and priorities annex, and also refer to the essential data tables. The new RSSH gaps and priorities annex asks each disease program to prioritize its RSSH requests, and then asks the programs to come together to discuss and further prioritize their requests. Then it asks for a funding landscape analysis for just the 2 or 3 main areas proposed by the disease programs. A word on the essential data table is that these contain the main indicators relevant to the country programs, as well as information that's really key to understanding the HIV-TB program essentials, which are explained in more information in the HIV and TB program information notes. This data can really inform whether the disease programs are on or off track and should be used to stimulate discussions on how to best move forward. Next slide, please. So this slide shows 2 main scenarios and reflects the program split form that CCMs need to submit before their first funding request. The first table is filled in when a CCM wants to confirm their program split as per the allocation letter. CCMs need to submit a confirmation plus indicate an indicative amount for RSSH from each disease. And as I just mentioned, this is a new requirement. They can earmark the same percentage for all diseases. So for example, each disease could earmark, say, 3%, or it could be different percentages according to the context in that country. If the CCM wants to change the program split, they need to submit a new proposed program split, which is shown in the second table. The new split is included in the second column in the second table. And as before, the CCM will need to propose an indicative amount for RSSH from each of the diseases in the right-hand side of the table. It is still possible to have a standalone RSSH funding request which often leads to a standalone RSSH grant. In this case, a CCM must move funds and document the program split change. So in the second table, you can see it's being highlighted that there's a row for RSSH. They need to fill in the RSSH row, and of course, still indicate in the right-hand column how much will come from each disease. So I hope that's clear, and there'll be instructions in the program split table if it's a little bit too fast. Okay, so turning to the next slide. I just wanted to end this section with a few tips on things to consider when you're having discussions during the country dialogue about prioritization, because you need to discuss how to best prioritize your allocation to maximize impact. So a few things to consider, and we have 6 there on the left. First thing is, and this goes back to what I was saying before, is that the CCMs really need to have a good understanding of the HIV, TB, malaria, and RSSH programmatic gaps, including for community system strengthening. And you can use the various tables, as I've already described on the right, to really facilitate this discussion. You should also be referring to the National Health Sector Strategy, the National Strategic Plans for the 3 diseases, and other subsectoral strategies to inform your discussions. Other considerations include what are the key risks to the HIV, TB, malaria, and RSSH program delivery, including to their quality and their sustainability, and how could identified priorities address the risks that have been identified. CCM should also consider the opportunities for integration of services, especially at the service delivery level, because these may deliver gains in equity, efficiency, and impact for the 3 disease programs. Related to this, CCM should consider value for money issues, including how to ensure the programs are made more efficient, effective, and sustainable. CCM should also be aware of all other funding sources for the identified priorities and what gaps can be covered by Global Fund funding. And of course, the funding landscape tables that you have to fill in on the right should be used to inform this discussion. Finally, CCM should consider if there are any lessons learned from the previous cycle. Are there any positive results that have been achieved, and how can these be consolidated? What were the main implementation challenges that you met, and how could these be addressed going forward? And finally, are there any TRP recommendations from the previous cycle that still need to be addressed? Just one final reminder that CCMs need to consider civil society and community priorities in their overall funding prioritization discussions, and we'll hear more about this shortly. So now I'm passing back to Lindsay to discuss the CCM requirements. Thank you.
Thanks so much, Olga, for taking us through some of the thinking process of what needs to happen in that country dialogue stage of preparing for the funding request itself. Now I'm going to talk a little bit about the CCM eligibility requirements, just one slide on this. As you likely already know, there are 6 CCM eligibility requirements, and 2 of these are assessed at the time of the funding request submission. Now, a CCM is expected, in order to be able to access Global Fund financing, to be compliant with all 6 eligibility requirements. But eligibility requirement 1 specifically relates to the preparation of the funding request, and it requires that CCMs can demonstrate through documented evidence a transparent and inclusive funding request development process. So we do require that CCMs keep the evidence of this in their files so that they can submit it to the Global Fund when asked. But we are not asking CCMs to submit all the evidence with their funding request. They need to keep that in their files. What we are asking CCMs to do in this next funding cycle is to describe in the country dialogue narrative a description of how they approached having a transparent and inclusive funding request development process. Which groups did they reach out to? How many meetings were held? So to give us a big picture of the experience of that transparent and inclusive funding request development. On eligibility requirement number 2, this is also assessed at the time of the funding request submission. The expectation is that a CCM is able to demonstrate, again with evidence, although they keep the evidence, they don't have to submit it, is they are able to demonstrate with evidence that they have gone through a transparent and documented selection process for their principal recipient, or principal recipients, plural. Many of our funding requests have one principal recipient, some have two, some have more than two. And the selection of the principal recipient is the responsibility of the CCM, and that needs to take place following the CCM documented procedures that are in the standard operating guidelines that each CCM would have. Now, it is possible for a CCM to transparently and in a formal way document the selection of the same PPR, same principal recipient, same PR for the next funding cycle, but that still needs to be something that goes through an official CCM process. If you have a well-performing principal recipient, a CCM could have a vote on continuing with that principal recipient, and that there's a much lighter evidence process for that. If the field is open for a new principal recipient, that requires a much more extensive, transparent, and inclusive process to be able to then identify and select that new principal recipient. And then finally, the last area of expected output for the country dialogue at the funding request stage is the funding request submission. So before we get to the next slide, hold your horses. I'm going to try to explain it in a bit of a new way. On the left-hand side of this slide, what you will see is the various forms and annexes that are really helpful for a CCM to start completing early in the country dialogue as input to the country dialogue, to be able to then have those hard discussions around what should be prioritized in the funding request itself. And then what you see on the right-hand side of this slide is actually the outcome of those discussions. So again, left-hand side, these are the types of annexes and documents that would help put in a clear way the data and the evidence that then would inform the analysis to then make the decision as to what the Global Fund investment should fund. And so that's described in the documents on the right-hand side. Many of these are familiar. So these are documents that are core documents that we've had as part of the funding request process for the last 4 funding cycles. And there are a few different ones. And so these are highlighted with a star, and I'll just speak to each of these briefly. First of all, at the top is the RSSH Gaps and Priorities Annex, which Olga already highlighted. This is a new annex, which is an opportunity to then have a much more clear picture of where the gaps are in our resilient and sustainable systems for health that would make the biggest impact on delivering on our HIV, TB, and malaria programs. So that Gaps and Priorities Annex is a very useful tool to feed into the analysis. On the bottom row, you see 3 new annexes, and they all have a little star beside them, which says, if available. And the idea behind this is that many CCMs we know have already, or our governments have already worked on human rights assessments and gender assessments. The request is, if available, please attach to the funding request, because they are providing a very helpful perspective on how these considerations have been addressed in the funding request submission. Additionally, there will be a new gender equality marker score that happens on each funding request that's submitted, and a gender assessment is a core part of being able to achieve a higher score in the gender equality marker. So if available, please do attach. And then the third area is the sexual exploitation, abuse, and harassment risk assessment. This is an area that the Global Fund is going to be very intentional about exploring further in the next funding cycle. There will be 10 countries that will be requested to submit this as a mandatory annex. And for all other countries, it is available as a template on the Global Fund website if you would like to already look at it and start that thinking, but it is not a required annex at the time of the funding request for those that are not identified as the 10 pilot countries. Now, as we get on to the right-hand side, these are the documents that really bring to life what the CCM wants to prioritize in its funding request for where the Global Fund investment would make the biggest impact. Performance and budget, performance framework and budget, you're familiar with. These are the core grant documents. One telling what it is that the actual grants will do and what they will achieve with their targets, and the other, the budget, saying how much it will cost. So these partner documents are ones that are very familiar to you. One that is new, though, is on the second line, which is a funding priorities from civil society and communities. And as was mentioned at the beginning of the presentation, one of the expectations of people and communities at the center of our strategy is to make sure we are hearing those voices. And an opportunity to do that at the funding request stage is to have the expectation that the civil society and communities groups come together and provide a list, no more than 20, the top 20 areas that they would propose for the CCM to consider in terms of most valuable investments that would make the biggest impact from the civil society and community perspective. The reason why we're asking for this is, one, it's actually a really important and useful exercise for the civil society and community groups to come together and prioritize what are their top 20 asks. Two, it's a valuable input to the CCM as they consider the prioritization for the funding request overall. And three, it then gives great insight to the Global Fund Secretariat about the priorities as identified by the civil society and community groups, so that we are able to then understand where that fits in the overall funding request, the prioritized above allocation request, and then in the grants themselves, both as they're developed during grant making and then in implementation. So this is going to be a very useful exercise and asset to the Global Fund Partnership for the next funding cycle. And then finally, I already mentioned the country dialogue narrative, which is a new expectation, but it allows the CCM to describe in written form how the inclusive and transparent dialogue was undertaken at the funding request stage, and keep all the evidence unless they are asked to submit that. Now, all of these requirements will be explained in much more detail in our next webinar, so I'm not going to go into more detail now. But what I am going to then reorient us to is, okay, so if we go back to this idea of the dialogue and what happens during country dialogue leading up to the funding request itself, I'm going to pass on to my colleague Colin, who is going to then share with you some best practices about country dialogue during the funding request development phase. Colin.
Thank you, Lindsay. Good morning, good afternoon, good evening, everyone. As Lindsay said, I'm going to speak about a few things that we really consider to be best practices during the country dialogue phase of funding request development. So the first thing is to plan. An engagement roadmap developed by the CCM is a key tool to ensuring a quality country dialogue that is also delivering a quality funding request in the timeline required by the specific country. The TRP windows for the coming cycle are already available on the Global Fund website. We strongly encourage CCMs to go look at those and start thinking about when you would like to be presenting your various funding requests to the TRP, and then work backwards to outline a plan for engagement with the stakeholders highlighted by Dennis earlier in the David, excuse me, earlier in the presentation. The second is about using data and evidence as a basis for discussions. Both Lindsay and Olga mentioned this before. Really here, available information about past grant performance, studies that have recently been done in country, the essential data tables that will be shared with applicants along with the allocation letter, any available data, already start bringing that together so it's readily available to begin the country dialogue process. As Lindsay mentioned, look at the Global Fund strategy and consider what changes will need to be made to future programs, future Global Fund grants, to really address the priority areas of that strategy and how those are aligned with national goals. Start mobilizing in-country partners now, including for RSSH. This is really going to help strengthen the quality of the dialogue once it starts in earnest after the allocation letters are received. As others have mentioned, and as my colleague Gilles will go into detail in a little bit, input from community and civil society groups is essential to ensuring a quality dialogue. The annex previously mentioned by Lindsay is a key tool to outline the priorities of these groups as part of the country dialogue process and ensure that those are reflected in the funding request where it's appropriate and where the CCM has agreed to include those. The writing teams need to be representative of all CCM constituencies, including communities, and have relevant expertise. This is particularly important in the area of RSSH. We'd like to specifically call out the interactivity between RSSH stakeholders on disease funding request writing teams and vice versa. Finally, giving CCM members enough time to meaningfully review the draft of the funding request to have an informed endorsement is really important to ensure everybody is bought in and aligned on the vision presented in the funding request. Next slide, please. Others have mentioned this earlier. One of the things we would like to emphasize in the coming cycle is the advancement of grant making activities during the development of the funding request. The key point here is that every cycle we spend a significant amount of time on the funding request process and on the grant making process. And then at the start of implementation, some of the key things that need to happen for grants to be implementation ready have not yet happened. For example, subrecipients haven't been identified or their contracts have not been prepared or signed. Key human resources has not been contracted by the PR. Suppliers have not been identified. The result is that there's often a lag in implementation during the first few months after grant signing. To allow PRs to have enough time to meaningfully prepare to be implementation ready on the first date of the implementation period, we are encouraging as much as possible grant making activities to move into the funding request period. What do we mean by this? Where it's possible, where PRs are continuing, where CCMs can identify those PRs and confirm them early, we strongly encourage that the PRs be part of the country dialogue during funding request stage, and that the level of detail of the documents, the detailed budget, the performance framework, be at the level that it needs to be for grant making with the active support of the PRs. This way, once the TRP has made their recommendation, the grant making process has a big head start. A lot of that detailed thinking about costing, targets, etc., has already happened in the funding request stage, and it buys time during grant making with the intent to sign the grant earlier. This has another benefit, which is that we know community and civil society stakeholders are much more engaged during the funding request process. And so by bringing that level of detail to the funding request discussions, gives those actors better insight into the details of the grant, the design of the grant, and how their priorities may or may not be reflected, and how CBO and CLO implementers may be considered for different aspects of implementation. So again, we strongly encourage all CCMs to think about this. We know that each cycle, more and more of our PRs are continuing PRs. So where the PR is well performing and they're going to continue, please think about how they can be engaged early in the process so that the grant can be as ready as possible for implementation on the first date of the implementation period. With that, I will turn it back to Lindsay. Thank you.
I think we're going to go right to Gilles, who is our colleague from the Community Rights and Gender Department, who is going to speak to us now about specifically the lens of community and civil society engagement throughout the funding cycle. Gilles.
Thank you, Lindsay. Hi, everyone. Lindsay, if we stay on the very first slide before going to the definitions, just a few words. So we've heard from you, Lindsay, and from colleagues about the 10 key changes from the new strategy of the Global Fund. And I wanted to get back to 2 of these 10 key changes in particular. The one that speaks to support the development and integration of community systems for health, and the one that speaks to having stronger voice and role of communities living with and affected by the diseases. So this is very important for our new strategy, and this is starting right now with the country dialogue for the new cycle. So on the next slide, before we go a little bit deeper on how we can ensure that happens, let's look at a few definitions so that we ensure we speak about the exact same thing. So at the Global Fund, when we speak about communities, we refer to people living with and/or who are most affected by HIV, TB, and malaria. Most of the time, they are what we call key and vulnerable populations, and they all have in common that an increased exposure combined with decreased access to services. The access to services to these communities is decreased for many reasons, including inequity, criminalization, stigma, among others. So it is clear that engaging with communities is not only about eligibility to access the allocation, which is definitely something that the Global Fund will watch carefully. As you know, it's an eligibility requirement, but it's also about having in mind that communities are best placed to tell us why accessing services is challenging for them. And they are also often well placed to deliver these services to their peers in support to the public and the private sector. So to engage them throughout the country dialogue is about really investing in the interventions adapted to people's needs and that will provide countries with the highest impact possible. So next slide, please. So currently, we do not engage communities so much beyond funding requests, and that's an issue. So communities and civil society are not sufficiently engaged during grant making, with the risk that community priorities are not reflected in the final grant design. Leveraging opportunities during the funding request and grant making stages is a key step in ensuring the meaningful, sustained engagement of communities and civil society during grant implementation, and can hopefully lead to reflecting better community priorities in the grant design, to also incentivize inclusion of community-led organizations implementers in the implementation arrangements. Colin just mentioned that, and also actively engage participation of communities and civil society in the CCM oversight function and activities. So how are we proposing to engage meaningfully communities in the country dialogue? First, during the funding request development, the expectation, as it was mentioned earlier, is that there is a transparent and inclusive consultation organized. That's for everybody. And then this is a condition to access Global Fund financing, as we've heard. This consultation will help fill in the funding requests, help with the prioritization, as well as the filling in the mandatory annex on communities, the new annex that Lindsay mentioned. We have listed on this slide the expectations, and I will just mention a few. The CCM secretariats, for example, must support communities to develop key priorities. For that, the CCMs can tap in their Global Fund CCM allocation and also help communities to mobilize the community engagement strategic initiative of the Global Fund, which is coordinated by the Community Rights and Gender Department. Another very simple but very useful thing that we've heard from communities themselves is to give them a minimum of 3 days as CCM members to review comments on the final draft of the funding request before they have to endorse and submit the funding request. Next slide, please. So during the grant making, community and civil society representatives on the CCM need to have timely access to information on status of grant negotiations and changes to the grant to support their involvement in the oversight. Amongst the expectations listed on the slide, I want to highlight the fact to have, for example, 2 CCM meetings with the principal recipient, presenting the key elements of the grant currently in negotiation to update on communities' priorities and plans for the community-led organizations' implementation arrangements. Best practice, in addition, would be to also have a meeting with the Global Fund country team, who is conducting the grant making, with the community and civil society representatives when they are in country. And that the CCM secretariats can help organize. During the grant implementation, community and civil society representatives on the CCM need to have timely access to information on program implementation. This is really essential if we want to maintain their engagement and contribution throughout the grant cycle, and also help to course correct for better impact. So let's remember, communities are the core of all we do. They are actors of the fight. They are not only clients, and they should be part of the design, the prioritization, implementation, for example, service delivery by community-led organizations, and the monitoring of the interventions. Next slide, please. And this is the last one before the Q&A session. Just this slide to share with you that the Global Fund CRG department, the Community Rights and Gender department, has a community engagement strategic initiative, which is available to help with the 2023-2025 allocation cycle. Whether it is to help communities to collect data, so to conduct some assessments, to do some situational analysis, or to help with supporting consultations, or to coordinate input from communities on application document, in particular the new annex that we mentioned, including costing. All of this can be done with the support of this Community Engagement Strategic Initiative and the support from other partners. The information on how to access this support is on the website, and you can also reach out to your country team and the Community Rights and Gender regional platforms. You can find information on the Global Fund website. To conclude, I just wanted to say that the key message really is that the meaningful community engagement leads to better grants and better results. No one is better placed than communities in your countries to let us, all of us, know what they need to accessing health services. So yes, country dialogue takes time. It's also a lot of effort, but without the engagement of communities in the design, the implementation, and the monitoring of interventions throughout the grant cycle, we will simply fail. And so the efforts and time spent on ensuring a robust country dialogue will be definitely worth it. Thank you very much.
Wow, thanks so much, Sheila. I've got goosebumps myself. That was very inspiring and a great reminder of the role that we all need to play in country dialogue, and specifically the role that we expect to see from our civil society and community groups throughout the funding cycle. So I would like my other panelists to please put their cameras on if they could. We're going to move into a question and answer time. And I'm very happy to see we have a good half hour to answer your questions. I'll just quickly remind you who the other panelists are in case that went over your head. My name is Lindsay. I am representing the Access to Funding Department. My colleague who was just speaking, Gilles, is from the Community Rights and Gender Department. Before him, you had Colin, who is representing the Grant Management Division. And then prior, you had Olga, who is a representative of the Technical Advice and Partnership Department. And then the very earliest presenter is David, who's the representative from the CCM Hub. So you have a broad range of cross-functional teams representing some different areas of expertise within the Global Fund Secretariat. And we are very happy to take a look at your questions now and do our best to try to answer some of them. And if we can't, then we'll get back to you, but we'll do our best in this first instance. So just for my colleagues on the panel to know, we have several slides of questions so far. And for our attendees to the webinar, if you have additional questions, you can put those into the chat, and our colleagues on the line will be putting them onto these slides for us to answer. So the first question that we have on the screen is that CCM and country dialogue is at the country level. However, what happens at the regional level? Is there a coordinating body or a coordinating dialogue? And I will answer that one, which is that because the Global Fund Partnership really identifies that country ownership is an important operating principle, we then have identified that the country dialogue related to the specific country allocation should be coordinated by the country coordinating mechanism. So that definitely happens on a national level. As it relates to multi-country grants, there is a different expectation that different communities, different countries, different organizational bodies would need to have a regional dialogue. And so as it relates to the funding request and a grant for either a allocation-based multi-country application or a catalytic investment multi-country application, there would be a regional dialogue that would take place. However, as it relates to the Global Fund base operations, there isn't an ongoing regional dialogue specific to the funding requests that are submitted to the Global Fund. Gilles, did you want to say anything about any coordinating bodies that operate on a regional level as support for dialogue?
Sure, I can say a few words. So we have indeed what we call the Community Rights and Gender Regional Platforms. So you will find the information and their contact details on the website of the Global Fund. And those platforms are basically asked by the Global Fund and contracted to do that to support engagement throughout the country dialogue of communities and civil society. So those are not coordinating bodies, but they do in a way have very important and useful information at regional level of what works, some do's and don'ts, and they are able also to translate a lot of the Global Fund jargon, which sometimes can be difficult for communities and civil society and technical assistance providers to help with the country dialogue. So I would encourage you to reach out to your CRG regional platform. That could be very useful.
Thanks, Gilles. So I will take question 2 and allow Olga to complement my answer. And then on question 3, just to give a heads up to my colleagues, I would hope that Grant Management and CCM Hub can help answer question 3. So on question 2, the comment is that often programmatic gap tables are not ready when country dialogue process starts, and these can end up being a wish list. What resources and support is available to ensure dialogue is really productive? Okay, so first of all, I want to turn this question around and say that the starting point for programmatic gap tables should actually be an NSP, a National Health Plan, National Strategic Plan, to identify the gaps to achieve the country goals and then eventually the global goals. And in fact, because we are already identifying that it is a best practice to actually start the development and completion of those prior to the active country dialogue, I would hope that this would then encourage many of our CCM partners to work with their technical partners in country to start the development of those programmatic gap tables early, because indeed they are one of the resources that will enable that dialogue to be productive. So many of these annexes that are required with the funding request submission are actually developed as tools to be able to ensure that we have a better prioritization in the funding request itself. Olga, did you want to complement anything?
Maybe just to emphasize that there are technical partners out there. In particular, we're working with the GIZ Backup and Expertise France. And I think for countries that work with those partners regularly, they should be able to support with the filling in these gap tables. And like Lindsay said, please start, thinking about it now. Window 1 isn't till March. So I mean, this is a good 6 months that you have to be able to work on this. Over.
Absolutely. Okay, so question 3, what are the qualifying requirements for funding grassroots organizations? This relates to capacity assessments for implementers. Colin, would you be able to provide any perspective on this?
I think I would want to know if we're talking about funding them to participate in the country dialogue or funding them as CBO, CLO implementers in the grant, because I think those are two distinct things.
Right.
If it's about the country dialogue, I would hope that David might be able to say more than I. David, is that okay?
Yeah, sure. In terms of engaging grassroots organizations in the country dialogue, absolutely. And I think one of the questions in the chat, I think, was kind of similar. So, I mean, 15% of the funding we give to all CCMs is supposed to be about engaging with communities and civil society. So CCMs should be doing this. Whether they all do or not is a different matter, of course. So I think there is quite often funding as well available from the CRG platforms who kind of work down into communities in countries. And quite often there is local partners as well who are kind of interested in supporting some of these groups. I think it is a real challenge because quite often there are access constraints, geographical constraints to participation. Sometimes where we can add value is perhaps through things like data bundles and supporting virtual participation or even just travel costs for people to kind of attend country dialogue meetings, which are held in either capitals or regional centres. But yes, in terms of qualifying requirements, I'm not sure. I think it's a bigger question when you come to, how do grassroots organisations become PRs and SRs? And I think, that kind of issue of the capacity assessment can be a big barrier. There's an interesting evaluation that's just finalising here, done by the TURG, the evaluation body that looks after Global Fund, on community engagement, and it found actually that community-based PRs were quite effective, quite high performing, but they really struggled to meet some of the kind of financial process related requirements that the Global Fund have, and that's probably the biggest issue for even smaller grassroots community-based organizations. But I think it's kind of like a call to be creative, and this is what some of the FPMs in the Asia region were talking to civil society about yesterday in one of the conferences pre-NFM4, pre-new funding round conferences in Asia, held by one of the regional organizations for civil society. And they were saying, well, why couldn't we think about designing something into a normal grant, that re-grants things out to smaller civil society organizations to do strengthening? Why can't we embed something, as part of a larger grant managed by a single PR, rather than also proliferate lots and lots of PRs, which can often be a problem because they all have to jump through these huge hurdles. So I think that the challenge is to kind of think differently, as well as actually about what the requirements are, and also for us to accept more risk at the bottom level. Thank you.
Colin, would you like to say something about the criteria that the Global Fund has as capacity assessments for implementers?
I don't think I'm prepared to speak to that, Lindsay.
So in terms of the requirements for a grassroots organization to become an implementer for the Global Fund, that's a very specific question that we will take away as something that we'll answer in writing in our FAQs. We don't have the right people on this panel to answer that question. In terms of question 4, Colin, I will pass this one on to you. What would you consider early engagement of a principal recipient?
So I responded in the chat, but I'll repeat now just for everybody's benefit. As early as possible, I think, is the answer. As I said in the slide about advancing grant making, we're encouraging this where the PR is continuing, where the CCM has identified the PR early. So basically, from the moment in which the CCM is able to confirm that the PR will be continuing into the next implementation period, that PR can then get involved in the funding request preparations. And yeah, the more time they have, the better quality of detail should be included then in the documents which are submitted, which will then hopefully buy time during grant making and ensure a more implementation ready grant by the time the grant is supposed to start.
Thank you. Question 5 asks about CCM eligibility requirements, and indeed CCM eligibility requirement 2 specifically relates to the selection of the principal recipient. That is the responsibility of the CCM. The identification of subrecipients then is led by the principal recipient, and so on. We have subrecipients, sub-subrecipients, etc. But the CCM is responsible for the selection of the principal recipient or recipients. Moving on to the next set of questions relating to challenging operating environments. What flexibilities does the Global Fund accord to CCMs that are not involved in PR selection? So indeed, there are a subset of countries where the Global Fund identifies the principal recipient. These could be challenging operating environments, but could be other countries that have been identified where additional safeguards are required. So in those cases, there is no requirement for CCM eligibility 2 to be fulfilled if the CCM is not responsible for the selection of the principal recipient. That would be clearly set out in the allocation letter. That's information that the Global Fund is transparent about. On question 7, how do you operationalize your definition of community with regards to malaria, which is endemic? It will translate to virtually everyone. Indeed, yes. Gilles, would you like to provide some perspective on how we think about community in the context of malaria?
Yes, thank you. We get that question a lot because unlike for HIV and TB, where they are very, very specific key populations, just because of stigma, criminalization, and difficulties in accessing services. For malaria, it's a little bit more difficult, but we do have key population for malaria, as you know. Of course, we're thinking about children under 5, pregnant women, refugees, internally displaced populations, in general, people who are lacking access, also undocumented migrants. So the definition around malaria for community is really, trying to have an organization at the CCM or at the country dialogue who can represent any of these groups, really, of these vulnerable groups most impacted by malaria. But I agree, everybody, it's endemic in Africa. Everyone is at risk almost in some countries. But there are some organizations that are very well equipped and who represent some of these vulnerable populations from malaria that can be the community during the country dialogue.
Thanks, Gilles.
If I may, Lindsay, I also saw a question around what if we have only one disease represented in terms of the communities or key population that the CCM, is that an issue? And David can speak to that as the CCM hub manager. But I think what we really try to encourage more and more is really a good representation of the 3 diseases, and also RSSH actually at the CCM table. Because when the Global Fund was born 20 years ago, the HIV community was very strong, and we had a TB and malaria communities who were less strong. And we've been trying to really support and build the capacity of the TB survivor networks and also malaria networks, malaria community over the years. And so really the objective is to have everybody at the table. So of course, we know it's difficult and it's not possible in all countries, but whenever possible, good representation of everyone is really a bonus, definitely.
Absolutely. And country dialogue goes much beyond CCM representation. But David Ennis, could you please speak to question 8 related to what are the requirements in terms of CCM membership and community civil society representation?
Yeah, thank you. I think membership is really driven by the epidemiology in the countries. CCM themselves have quite a lot of leeway in terms of deciding who and how many numbers and how big even the CCM is, and they codify those in their bylaws. But we do ask them to justify that against the epidemiology, and increasingly we're coming back and challenging them a little bit on that and saying, as Gilles says, you wrote your bylaws 15 years ago, but things have moved on. Suddenly now you have a TB grant you didn't have before. Where's your representation? But in practice, I think, where you have grants in the 3 diseases, you do have multiple representation. Certainly for all of the 40 high incidence, high burden TB countries, you do have TB representation on those CCMs. For malaria, it's a little bit more dependent. But I think, as Gilles said, ideally we would want each, community civil society representation for each of the 3 diseases, as well as perhaps technical representation as well on the CCM. But it sometimes takes a little while to get there. Thank you.
Thanks very much. And I do want to also add one point to that, which is that the representative who is the official signatory, the civil society representative who then signs the grant, etc., is expected to then coordinate with broadly the community and civil society groups, that they're not only representing their organization, for example, that there is an expectation of being able to be a representative of more than just one organization at a time. Question 9 is a really sticky one that the Global Fund wrestles with a lot. And Gilles, in your experience, both from a FPM perspective as well as a community rights and gender perspective, do you have any insights that you'd like to share about how we manage the delicate balance to make sure that community groups that would be facing stigma and discrimination or potentially criminality would then be able to operate in the context of a CCM where we have government representatives as well?
Yes, this is a very, very difficult one, but thank you for the question, because I think it's something everybody has in mind, and sometimes it's the elephant in the room in many countries. So, okay, there is no perfect answer for that or advice, but I can speak of my own experience when I was a fund portfolio manager and working in some countries where my first meeting at the CCM was basically having, the Ministry of Health saying that, representative of LGBT should not be here because they don't have a voice, that they should not be able to speak, etc. So, starting from very far from where we are supposed to be. And I think it's been a journey, and I want to highlight one new piece of language we have in the strategy, which is the use of the diplomatic voice of the Global Fund. Mm. And so I would really encourage communities in countries where they are criminalized and cannot even be a member of CCMs or are not heard when they are at the CCM, to reach out to your country team and to bring their responsibility of using their diplomatic voice to support your engagement throughout the country dialogue and the whole cycle. This is not going to happen overnight, and this is something we take very seriously at the Community Rights Internal Department, and we will support the country teams to do that. I just wanted to say that this question 9 is also related to what we are also trying to improve at the Global Fund, which is safety and security for key populations and implementers of key population programs. Because in the same countries, we have had very, very terrible stories and cases of breaches of safety and security for populations, either for the clients or for the implementers. And this is something that we acknowledge as an organization. We haven't paid sufficient attention until now, but this is also something that is changing and that we will discuss with the CCM, train the CCM members on safety and security for key populations, train our own country teams as well on this issue, so that they can also, add to your concerns and your voice when they are in country to make things change a little bit. But I know it's not the answer maybe you want to hear. It's really country specific as well. But at least we can try to do that, and this will hopefully improve the situation.
Indeed, thank you. Are there any other panelists who want to contribute any thoughts on question 9?
I guess to just come in and really echo what Gilles was saying. I think it's really tough in practice, but the key thing is surfacing the issues so that the country team, so that CCM Hub, CIG, regional networks, OIG as well know about these and can put pressure. The community delegation to the board has a strong voice, had a strong voice in the development of the strategy, and does raise some of these situations up to board level within the Global Fund sometimes. So the key thing is is to feel there is a voice, even if it's frustrated at country level. I think it's important, and then slowly to try and move things in the right direction. And there are many countries where that has happened, but it has kind of taken substantial time and wearing down of resistance in some places. But I think there's some examples in things like the Breaking Down Barriers initiative and things like that, which are very, very relevant as well. Thanks.
Indeed, and the Global Fund does work on the advocacy side, often in the background, but it is an area of effort of the Global Fund. But related to this question in terms of the specifics of how do we make sure that the civil society voices are heard in those country dialogue discussions, I do recall hearing many different creative examples of how that has been done in countries where key population behavior is identified as criminal behavior. And sometimes what that means is having separate discussions, but that a representative could be from the Global Fund or a technical partner or another organization, then brings that voice into CCM discussions, even if not everyone is able to sit at the same table. So certainly there are creative opportunities that we, and the Global Fund side, are very interested in pursuing to ensure that those voices are able to be part of the discussions, even if the individual is not able to stand up themselves. We'll move on to the next set of questions. Is there question number 10? Is there a model on how to make country dialogue inclusive in countries where a large part is difficult to access because of insecurity and humanitarian situations? Indeed, we have a lot of those countries in our portfolio of eligible countries, unfortunately, a large number where travel is difficult to impossible, and the idea of inclusive dialogue looks challenging when you're not able to meet in person. I'll just add my 2 cents and then open it up if other panelists would like to contribute. In those circumstances, we actually saw a significant uplift in the breadth of individuals and different types of groups included in the dialogue in the last funding cycle because of the shift to having virtual conversations. And as we saw in some of the examples in the country dialogue slide at the beginning of the presentation, those could be using new technology features. It could be WhatsApp videos. It could be an opportunity to have groups of conversations happening on a video call using a technology like we have today, like Zoom. It could be done by mobile phone calls. There are lots of different ways that dialogues can continue, even if individuals can't travel. I think the important element to consider in those circumstances is for the CCM to work with, especially any technical partners that might be available, but the CCM to work with an engagement plan to be able to then anticipate that they may have difficulty reaching certain groups or certain regions, and then how would they bridge that, looking at creative solutions to do so. Any other panelists want to contribute to question 10?
I guess along the same vein is, particularly if it's a humanitarian situation is happening in the country, there are often international humanitarian mechanisms, coordination mechanisms in place. Quite often these are reaching out, including right down to the grassroots levels. And so one of the things that we've been talking about is this idea of the humanitarian development nexus. And in those kind of countries, how do we work with CCMs to make sure that they're connected and positioned in relation to these? And that obviously then has an impact on how they would partner with these as part of a country dialogue. Thanks.
Thanks, David. Okay, let's move on to question 11. Somebody got scared. According to slide 17, it looks like the CCMs need to prepare a lot of information. This is true for the funding request submission itself, and particularly in order to prepare for the thinking on RSSH. I'm really glad you got that message. This is not something the Global Fund has done at the level that we would have liked in the past. And so this really is a step change for the Global Fund expectations and for the Global Fund partnership to really then actively dig into what are the RSSH gaps, what are the gaps on our health systems, the way we think about integration of services, integrations of systems themselves. Yes, that is a deep thinking work that is required, and it does need to start now. The second part of the question is, has this been communicated to CCMs? Well, this session is part of the communication to CCMs. As we saw in the chat at the beginning of the webinar, there are many different CCMs represented, and these expectations have been made clear in the funding request instructions. Those were published on the Global Fund website in July and are available in English, French, and Spanish. So I would certainly encourage CCM members to read the funding request instructions soon so that they do understand the breadth of information that will be required in the funding request itself. I also want to respond to the last part of this question is, it feels like countries have a lot of work to do that might not be done by December. This is going to be a work in progress. And as Olga mentioned, the submission for window 1 is in March 2023. That's 6 months from now. So we don't expect everything to be ready for the dialogue that starts in December, because sometimes the dialogue starts even earlier than that, or it might start later than that. The intention is to really kickstart the understanding behind, yes, there is work to be done. Yes, understanding RSSH requires a lot more analysis than what we have done in the past. And it is something that will be beneficial and necessary for the Global Fund to be able to increase the impact of the investment that we have available to us in the next funding cycle. Olga, did you want to complement my response on question 11? Anything else you want to add?
No, because I'm looking at question 12, and I think you did a really good job, because you said everything I would have said for question 11. And because I have to go in about 4 minutes because I have a doctor's appointment, I just wanted to see if I could try to hit some of the questions that were in the chat around the program split and the gap analysis tool, and kind of all things RSSH in general. And apologies if I don't get to all of them, because there's been so many. So in terms of the program split, yes, we know that it's not an easy conversation to have. We tried this in NFM1, and a lot of countries were just very lost. So we're trying it again. Hopefully it'll work better this time, but I'm not sure. There will be instructions in the program split tool, like the form, so you should read those. So that'll tell you about the timing, and if you have a percent or a number, and what you should be doing, and the justification, et cetera, et cetera. We are planning on putting some language, and Lindsay, maybe you want to come back on this, in the allocation letter about sort of benchmarking RSSH. We're not quite sure if we're going to give a number. I mean, in general, in the past, for like the last 10 years, the amount spent on RSSH has been on average 10%. For some countries, it's lower. For some countries, it's quite a lot higher. So it really depends on the country. So I think my advice to you would be to look at what you've been spending on RSSH in the current cycle, and then figure out if you want to increase or decrease that given the priorities that you have in the countries. The gap analysis tool should help you with that. Like Lindsay's saying, I mean, it's sort of 6 months till we have to sort of submit it. Please have a look, because the gap analysis tool is trying to give a framework for a set of discussions. We would like the programs to own the RSSH. So many times we go to countries and the HIV, or people are like, oh, these RSSH people, we don't even know what it is. And that's not right. What we want is for the HIV people and the TB and the malaria colleagues to really own the RSSH and say, this is collectively what we've decided on, and this is what we think we want to focus on. And then work with the relevant actors within the Ministry of Health and others to make sure that that's done very well. And that tool, that gap analysis tool, or I should say the annex, the RSSH gaps and priorities annex, is meant to kind of just structure a little bit those discussions. And just to reassure you, we're not asking for the gaps to be filled in, like the funding gaps to be filled in for all RSSH areas. I mean, I take Erin's point that often it's a little bit unknown. So it's just for the main ones, and to sort of try to understand and give the TRP and the country team and the entire secretariat some sort of idea of what the funding landscape is. Are there other things I should say? Because I really do have to go, because I know we want to translate it into French and Spanish.
Okay, Olga, I think we can release you for your doctor's appointment. Health is important for the individual as well as global health. I would just add on one nuance on question 12's response is also that the program split decision is a CCM decision. So this is not a discussion that we would expect everyone involved, the hundreds of stakeholders involved in country dialogue, to be weighing in on. This is a decision that needs to be taken by the CCM, does require to follow its own bylaws in terms of voting, etc. But it is not a broader discussion on program split itself. The broader discussion really should be on, within the funding that is available for the funding request of particular component, HIV, TB, malaria, or RSSH, if there is expected to be a standalone RSSH grant, within that that conversation, that broader conversation, what would the stakeholder input be on what should be prioritized for Global Fund financing for the final grant? So that's really where that country dialogue emphasis should be. On question 13, which is related to multi-countries, we will have a separate session on multi-countries when we have more information around the funding available for catalytic multi-country funding requests and grants. So I'm going to save that question for a future webinar. And then just considering that we have 3 minutes left, Gilles, would you be able to respond to question 14 about the community engagement SI?
Sure. Very easy. The Community Engagement Strategic Initiative, the requests need to come from the civil society, community-based organizations, community-led organizations. The CCM are important because it's great if the CCM secretariats coordinate all the TA requests, but our Community Engagement SI is really eligible for CSOs, CBOs, and CLOs.
Thank you. And David, would you like to respond to question 15 around conflict of interest in selection of principal recipients?
Yeah, thank you. I mean, that is eligibility requirement number 2, basically. Yes. I think that the CCM selects principal recipients in a kind of fair and transparent way. So how do we manage that in practice? I mean, outside of the funding request cycle, we promote the kind of ethical behavior of CCMs. So all CCMs are required to have a conflict of interest policy and to sign a code of conduct that spells out how they will manage conflict of interest. What's important is that there will always be, to a degree, certain conflicts of interest. You're bringing together all of the stakeholders who are involved in the response. So there's always going to be an element of conflict of interest, but it's how it's managed and mitigated. And what rules are agreed in each CCM for kind of managing that, and then whether they stick to those rules in practice. And when they don't, then quite often people complain to the Global Fund or through the OIG, and then we go in and investigate, and that can obviously affect the eligibility of the funding request ultimately. Thanks.
Thank you. Okay, in the remaining minute, on question 16, which is our final question that we have on screen, how can country dialogue and consultations around national strategic plans feed into funding request development? Well, the idea is that all these discussions that should be taking place as part of country dialogue with a broad range of stakeholders should then influence the selection of which modules and interventions the CCM is proposing to finance with the available Global Fund funding. So it will eventually be a subset of the CCM that is on a writing team, maybe with some additional support, that would then put that into an overall narrative and then work with the program side on the technical side to develop the performance framework and the budget that goes along with it. But it should be influenced by the discussions around the optimal service delivery approach, the optimal approach to overall investment that would make a bigger impact than what we have been seeing with Global Fund financing in the past. And so that's really where this dialogue should make the biggest difference. And indeed, the funding request should take as a starting point the National Strategic Plan, and the consultations to feed into a better National Strategic Plan can also complement the overall funding request development as well. So it's now 5 o'clock. I thank you very much for your engagement all the way to the end of our hour-and-a-half webinar on community, on country dialogue, which has covered off the who, the what, the how, and the community role in terms of community and civil society engagement as our expectations are evolving for the next funding cycle. Thank you for your time. Thank you to my fellow panelists for their time and sharing their expertise with us. And we hope to see you again in an upcoming session as we look ahead on developing the funding requests, sustainability, program essentials and information notes, matching funds, lots of interesting topics still to come. So thank you for today and look forward to seeing you next time. Bye for now.